Good evening and very good evening to all of you. Today we are going to discuss the case note of Miss Margaret Helen Martin. This is an old lady, an aged lady. She had her second angioplasty following coronary artery disease. Now she is getting discharged tomorrow. So before discharge, you are contacting the nursing in charge of a district nursing service, outlining Miss Martin's situation, what's her situation right now, and anticipatory needs following her return home tomorrow. So what should be there in your letter is that the number one, you need to outline Martin's situation. Number two, you need to clearly picturize the anticipatory needs, what she needs after her return home. So this is what we are going to say in this particular task here. This is a lengthy case, so you might find it difficult to and often confused to identify the exact data, what to include or what not to include. So let us see from the very beginning. You're a ward nurse and the cardiac unit of Greenville Public Hospital. Your patient, Miss Martin, is due to be discharged tomorrow. Now, so this is an old lady. She's 81 years old. And she got admitted today. That's on 15th of July, 2017. So we have social history here. We just need financially independent, and we just need to say that she's living alone. We don't need to say about her habits, meals on wheels, all these things, because we have something else to say, something regarding her diet. So we are not going to say what exactly it is now. Now the coronary artery disease, CAD, we have to say somewhere. Angioplasty, repeat, this is something we need to say here. Discharge, that's tomorrow. We are writing the dates. One date at 15, another date is 16. So it's just discharge date is tomorrow. So today is the day where she got with the surgery. Now, medical information, we have a lot of blah, blah, blah here. Angioplasty 2008, that was discussed earlier. Celiac disease had no relationship right now with this. Now, she's anxious about health, tend to focus on health problems. A lot of things are there: CADS, heparin, copy, hypertension, hypercholesterolemia, the medicine. So all these things you can now include all these things. We need to briefly outline what has happened to Miss Martin, why she was admitted to our hospital, what was done, and what's the condition right now. This is what we have to say. But we have to say that in the past medical history, we need to say something relevant. Things, hypertension, hypercholesterolemia, overweight, all these things we can say. We don't need to say family history of CAD. No. Now, what's her condition right now? The condition, her situation is she's tolerating diet. She's tolerating light diets and fluids. She has catheter bruises at catheter insertion site, no signs of infection. So that's her condition. Post-operatively, she does have no serious problems except the bruising at the insertion site. Now something relevant is coming here. That is this part, the discharge plan. We have diet-related, physiotherapy-related, and other related. So first we go with diet-related discharge plan. Low calorie, high protein, low cholesterol, gluten-free diet. Small, frequent meals. Drink plenty of fluid. So this all data is very important in the letter. Now, physiotherapy, daily light exercise plan monitored by the physiotherapist. No heavy lifting for 12 weeks. So we don't need to include this heavy lifting because the patient is aged and she's 81. So that is not that much relevant. If you want, you can include that. But I don't think that there will be space for you to include because the letter becomes too lengthy. Now we have under other, it comes first, monitor wound site for bruises or infection. So she already has bruise there. So you need to monitor there. Monitor adherence to medication regimen. Arrange regular family visits to monitor progress. So all these things. So 3 heads you had seen now. One was dietary, another one was exercise. And then this is other. Now, what we need for the patient is home visits from the community health or district nurse to monitor adherence to post-operative medication, exercise, and dietary regimen. You have seen that those things before, what exercise, what diet, all these things. Regular monitoring by dietitian, a physiotherapist, and her own doctor. So that's something else there. Now we need to inform that she is at risk of social isolation because of infrequent family support. Sorry. So that's all we have here in this letter, which is relevant. So I can make this thing a little bit bigger so that you can see. Make it bold and bigger. Yeah. Make it red. Yeah. Now, 15 July 2017, that's today's date, the nurse in charge, district nursing service, all these things, you know. Now let's go to the first part. Yeah. Miss Margaret Helen Martin requires regular home visits from your facility to meet her anticipated needs following her discharge tomorrow. She underwent an angioplasty today. So we have not said she has undergone an angioplasty. We said the day, that is today. So as far as the time frame is there today, so we have to use simple past tense, and that's the reason why I use underwent there instead of has undergone. Please understand, when the time frame is there, you have to use simple past tense. So that's the reason why I have done. She underwent an angioplasty today. So many students ask me, what's the difference has undergone and underwent? So there's a difference. Underwent is used just because today is there. Okay. Now that's not the problem here. So we have to make things very brief because this is a lot of information we need to add in this letter. So this is a challenging letter for many because we need to include some, you have to write about the patient's situation. If you need to write about the patient's current situation, you need to add some of the background information. That's number one. Now, anticipatory needs you need to write. And in between, you have to write some of her past medical history and financial and social condition too. Just a sentence or something like that. So Or for all these things, you have to frame more sentences and more words. So this is really a challenging situation for many students. Now, let's go ahead with the first paragraph. The aforementioned procedure was done at our hospital since Miss Martin was diagnosed with coronary artery disease the second time after 2008. So this is something which we have tried to consolidate the data in a single sentence. A lot of data is there. So we have mentioned that she had coronary artery disease, and this is not the first time she's having this disease. She had this thing before, and that was in 2008, and she had this angioplasty at our hospital, and that was today because it was there in the beginning. So it was there in the previous paragraph. Now, post-operatively, her overall progress was satisfactory, except some bruises at her catheter insertion site. Now, we can say that we have some problem. That was some bruises at the catheter insertion site. So other than that, we don't have any major problem with Miss Martin. No. At our care, she was reviewed by a dietitian who advised her a small amount of low-calorie, high-protein, low cholesterol, and gluten-free diet at frequent intervals, and by a physiotherapist who recommended her light exercises with supervision. Yeah, I have an option here. Light exercises daily with supervision. I can see under supervision. Okay. So this is a complex sentence. We have used a lot of punctuations there. So these punctuations are used to separate the segments in the sentence. That's a lengthy sentence there. So use your punctuations appropriately and correctly, accurately. So that's what we have done. We have to include a lot of things there. We have to include what we have to say that a dietitian was seen. She was shown to a dietitian, and dietitian recommended something. She was shown to a physiotherapist, and the physiotherapist had recommended this thing. So a lot of things we have to include, and these all are included in just a sentence, and this is the problem there. Now we have the next paragraph, and this is about the social and medical history here. Despite being alone, overweight, and having some hearing issues, Miss Martin is financially independent. She has some problems. She's living alone, she's overweight, and she has some hearing issues. But she's financially sound, she's financially independent, and that's what we have, the positive side too. So these all data is a background information condition of Miss Martin. Now, she has been under regular treatment for hypocholesterolemia and hypertension. We are not going to say the medicine name or these things. If you are going to say that, you cannot complete the letter. Still, the letter is big. It's around 190 to 200 words right now. It would be appreciated if you could arrange home visits for Ms. Martin to monitor her medication compliance and assess her wound site for any signs of infection. So specific needs we have outlined in this particular paragraph. Now, it would be appreciated. What? If you could arrange home visit for Ms. Martin for what? To monitor her medication compliance, number one. Number two, to assess her wound site for any signs of infection. So for these two reasons, we have said in the first particular sentence. Second sentence, kindly encourage her plenty of fluids, and please confirm that she's visited by her dietitian and physiotherapist regularly. So she is visited by I need to add doctor because it was there. She was visited by her doctor, dietitian, and physiotherapist regularly. So, of note, she is at risk of social isolation, likely due to infrequent family contacts and support. So, we don't need to mention what is the reason: infrequent family contacts and support. But if that may be a solution for the social isolation, or that can be a measure to prevent such of the social isolation, the district nurse or the community nurse can make it as a measure to solve the issue. So that's the reason we have included it, or else it's not actually needed. So we just needed the dietary requirement, the exercise requirement, and other requirements. All these things we have done there. We have outlined the condition of Miss Martin, and we have outlined what she needs after her discharge tomorrow. That's all the letter is. Thank you. We'll see with another letter soon. Thank you.